My name is Dr. Richard Slatkinem. I am the Director of Bloodless Medicine and Surgery at the Maimonides Medical Center. My area of specialty is obstetrics and gynecology, and I'm board certified in 1982. My medical training did my pre-med at New York University, medical school in the University of Bologna in Italy. My professional career started with a rotating internship at Long Island College Hospital and residency in obstetrics and gynecology at the Brookdale Hospital Medical Center. I'm also a board-eligible ophthalmologist, which I did in between residencies. Between my internship and my residencies, I'm also an ophthalmologist. My particular area of interest started about 25 years ago dealing with a Jehovah's Witness patient who most people know will refuse blood. And it was such a uplifting, rewarding experience. I decided to pursue that area. And over the next 25 years, I've developed techniques and skills and expertise that I hope to teach other people in the future. And it's my particular area of expertise, something that I'm very passionate about. Current trend in the field of bloodless medicine surgery is to try to reduce and eliminate the use of transfusions. The cost of blood is very, very expensive. The number of people who are available to be donors today is getting less and less. And through the years of research and clinical experience, we've realized that there are infectious and non-infectious complications of blood, and so we try to avoid those. This all really started in the early 80s when AIDS became the epidemic, that the medical community started to realize that there are complications of the use of transfusion. And from that really developed a subspecialty unto itself. And the Joint Commission is very concerned about complications of medications and blood. And so the current trend is to try to have a blood management strategy program within hospitals to reduce and eliminate the use of blood where it's possible. There are some wonderful breakthroughs that have happened in the last 20 years. Breakthroughs in technology, breakthroughs in medication, and breakthroughs in techniques. Some of the medications are, we call them wonder drugs, where they stimulate the bone marrow to produce blood cells much faster to help us avoid using blood. The technologies that are available today, we have second and third generation cell savers, which while you're operating, we can actually suction the blood, filter that blood, and give it back to the patient in a closed circuit so the patient doesn't require getting allogeneic blood transfusions. The third area of breakthrough has been in anesthetic techniques, the kind of anesthetic agents that they use and the type of hemodilutional anesthesia and anesthesia. We can't do the kind of surgery that we do today without the expertise of the new breakthroughs in anesthetics. And fourthly and lastly, the technology involved in the surgical instruments that we use, areas like laparoscopy and robotic surgery, minimally invasive surgery. These are all innovations which are helping us to reduce the size of incisions and the amount of blood loss during surgery. Patients recuperate faster and require less blood and are out of the hospital sooner. So those areas that are coming in the last 20 years between the medicines and the anesthesia and the new technology, that really helps us to have these programs and treat patients without the use of blood. What patients know about me and my practice is that I and my staff will treat all patients with caring, with kindness, with dignity, and a sense of professionalism. That when the patient walks out the door, they know that it's not only health cure, but it's also health care.